Implementing a Patient-Focused Strategy to Improve the Digital Patient Experience, sponsored by Webex. Our speakers today are Natasha Romantol, Digital Health Strategist with HIMSS, Brian DeCicco, Manager of IT Development with Kaleida Health, and Kenny Bloxom, Global Healthcare CPaaS Director with Webex DeCicco. Welcome, Natasha, Brian, and Kenny.
Thank you.
Thank you.
Thanks for having us.
So before we begin, please tell us a little bit about yourself. And Natasha, we'll start with you.
Sure. Natasha Romantol, a digital health strategist with HIMSS, and I'm responsible for the DHI, the Digital Health Indicator tool, as well as the Community Care Outcomes Maturity Model. And by education and training, I'm also a nurse. Happy to be with you today.
Great. And Brian?
Hi, I'm Brian DeCicco. I'm the manager of the IT development team here at Kaleida Health. And I've been here for over 20 some years and have seen everything along the way.
Great. Thank you, Brian. And Kenny?
Hi, my name's Kenny Bloxom. I'm the Global CPaaS Healthcare Director for Webex CPaaS. CPaaS, if you don't know, is Communication Platform as a Service. I've now been in healthcare for nearly 15 years. I most recently been Managing Director of our patient engagement platform in the UK, where we are the market leader for patient engagement. I'm looking forward to talking to you a little more today about the topic.
Great. Thank you, Kenny. So healthcare organizations have been focusing on the patient experience with the rise of consumerism in the healthcare industry. They've also had to scale up virtual care and other automated digital services significantly during the pandemic. Now we're at a point in our digital health transformation where we're transitioning away from a one-size-fits-all approach to a more personalized approach for the digital patient experience. But how do we do that? And what does that look like? And what strategies and technologies can successfully support this transition? So today we're going to find out. So Natasha, I have a question for you. The first question for you is, HIMSS created the Digital Health Indicator to support digital health transformation. Can you talk a little about the DHI and its relevance to our discussion today on improving the patient experience?
Sure. Thank you, Patty. So HIMSS Digital Health Indicator, or DHI, measures progress towards a digital health ecosystem by looking at an organization's existing assets to determine the digital capacity of that health organization. And it uses 4 dimensions that were proven to advance digital health transformation. And it's based in principles and evidence of HIMSS Digital Health Framework. So those 4 dimensions that are measured with DHI are interoperability, looking at mobilization of data from multiple sources, that seamless flow of data across teams, organizations, and populations, as well as clinician use of secure digital tools. The second area, which I think is pertinent to our conversation today, the second dimension, is person-enabled health. And that is essentially the adoption and use of personalized digital tools of choice by the individual to manage their health and wellness, taking into account the patient's unique life circumstances, their values, as well as their needs to guide care decisions and provider communication strategies. But it also looks at the effectiveness of proactive, preventive risk mitigation strategies and the use of data to segment population health outcomes to support health and wellness. The third dimension is predictive analytics, essentially looking at using collected data to determine future outcomes, and analytics proactively identifies risks to keep people well and also to track outcomes. And the last dimension is governance and workforce. Does the organization have a leadership strategy for the stewardship, the transparency, and the policy and decision-making of advancing digitally enabled care delivery informed by outcomes data? And also, do you have a workforce capacity and are you equipping that workforce to ensure that they are competent in the advancement of digitally enabled care delivery that's informed by outcomes data? What I'll share with you is that globally, the 2 scoring dimensions within DHI are person-enabled health and predictive analytics, which is not surprising to me because these 2 dimensions are related. You have to be able to identify your patient in order to personalize their health and wellness. And digital capacity enables people to manage health and wellness with the support of health teams. And without evidence-based data and insights, healthcare organizations have no way of knowing if they're optimized for digital health transformation or what outcomes they are truly achieving. And DHI is outcomes focused. So in our discussion today, I think it's important to highlight that offering person-enabled care or person-centered care is actually an outcome. It's not a strategy. Because as the old adage says, it's important to know what sort of a patient has a disease as it is to know what sort of a disease a patient has.
Great. Thank you for that. So Brian, tell us about Kaleida's digital health transformation journey. What were your pain points and barriers in trying to improve the patient experience, and how did you resolve these issues?
Well, we've been doing digital transformation for over the past 20 years, targeting a lot of the low-hanging fruit, a lot of paper processes moving over to digital. But it wasn't until a year or so ago that we really started taking our digital transformation seriously. I was asked to chair a steering committee, a digital health steering committee that was comprised of 50 to 60 people from across our organization, from CNOs to CNOs, site leads, IT, back office staff, as many people as we could get from across the system. And we went through a digital capabilities assessment session that helped us identify where we were as an organization, where were we doing well, where were we doing okay, and where were the places that we really needed to pay attention to. Out of that capabilities assessment, we transitioned to doing our patient journeys, as well as employee and provider, but we are focusing on patient first. Doing those patient journeys has allowed us to evaluate every touch point a patient would go through in their experience with us. And we could coordinate our digital inventory or our digital solutions with each of those touch points. And that has really started to show where we're doing well, where we're doing okay, and where we're not doing well at all. And that helps guide us as to what we're going to do next. As far as pain points go, we get a lot of buy-in from any of our stakeholders that we bring this discussion to. They think it's a fantastic idea. They've seen these things firsthand themselves, but it really does come down to resources and time. Some digital transformation efforts are expensive, and it does require a fair amount of time on the stakeholders' parts in addition to IT itself. So once we've gotten buy-in and the resources put behind it, we've made some advances. We have a long way to go, though.
Right. It sounds like really getting those champions are really important, an important step.
Very much so. A lot of this discovery was IT driven, and we need the business support behind it, ideally, in the end. They're the ones who are seeing the patients. We're helping to support them. So unless we have their buy-in, we're a little stuck.
Thanks so much, Brian. So Kenny, can you talk about patient activation and why it's so important?
Thanks very much. So first of all, patient activation, we've heard the concept, and it describes how a patient manages their own health and their own healthcare through their own knowledge, skills, and confidence. And before I tell you a little more about patient activation, why is it important? Well, we do know that all healthcare organizations, across North America and across all of the regions, are under a huge amount of pressure with the challenges they're facing today. That includes the rising cost of healthcare, due to inflation, due to interest rates, chronic care prevalence, and also aging populations, right through to, equity problems in terms of, equity health. And then finally, we've still obviously got the workforce problems that we're trying to deal with, in all areas. So, the reason why patient activation is so important is because we know patient activation does actually align itself to clinical outcomes, the cost of healthcare, and also as well, obviously the overall patient experience. And a patient with high levels of activation will generally play an active role in staying healthy and managing their chronic care condition if they've got one. They're more likely to register for either their MyChart or their medical record or their patient portal. They're more likely to follow their care plan. They're more likely to adhere to the medications. They're more likely to turn up to appointments. And if they're not going to turn up, they're more likely to cancel, and to want to rebook. Whereas patients, who have low levels of activation, they don't actually play that much of an active role within their healthcare or their chronic condition. And part of that would be because of the confidence they have around knowing their own self-assessment around their own healthcare. Maybe they don't understand, completely in terms of what the doctor is telling them about their care plan. So that all plays into that sort of low level of activation. Also, as well, about 25 to 40%, of the population will actually have low levels of patient activation. So they're really an important patient cohort that we do need to focus on. And they would be the patient cohort that maybe would use accident emergency a little bit more, but also as well, maybe get readmitted after being discharged, from hospital. So they're really, really important. And ultimately, more patients that are activated will also have more of a positive impact in terms of the health ecosystem today. What I'd like to do, if you don't mind, is just share a little bit about my mum. So my mum, is 15 years diagnosed with MS, which is progressive. She's had a really tough 15 years, had to deal with the disease, but also as well, that progressive symptoms as they go along. And over the last couple of weeks, I've spoken to my mum about, sort of her activation of her own healthcare and her condition. She also as well completed the PAM, which is a patient activation measure. And the patient activation measure essentially is 13 statements, and you either agree or you disagree with the statement. And lo and behold, my mum, as I would have expected, actually did have high levels of activation around her healthcare. And out of the 12, she actually agreed or strongly agreed with the statement. It's quite interesting one. The one she didn't actually agree with was, I am confident that I can tell where I need to go to the doctor or whether I can take care of a health problem myself. And I thought this was quite interesting. So I asked her, what was the reason, why you didn't disagree with that statement? And she said, with her having now 15 years MS, she's obviously got her symptoms, that she's used to every day. But there will be times when maybe she does actually get another symptom that she's not aware of, she's not had before. And she hasn't got a direct link into her care team, which is a problem. Yeah. And that's part because of the workforce pressures that, hospitals are under. But ultimately what she felt was that, if there's a new symptom that comes back, even though she's highly activated and she understands her own condition, she does feel sometimes left a little bit hanging, that she's got to try and work this out herself, or maybe she might use Google to try and find a little bit more out, or she might use one of their online community groups for MS. And I think the point that I'm trying to make here is that, whilst, yes, we need to focus on patients that are not, completely activated in the healthcare, but we also can't forget as well patients that are highly activated. And as Natasha says, that is very much that, that person-centered approach. And this diagram here, it is work that we're doing with our healthcare organizations to really modularize and how we can activate patients, or patients that are activated, how can we support them further within their pathway? And straight away, I'd be saying virtual assistants, what can we do to provide some automation, directly into my mum's care team, with, obviously the ability for my mum to ask questions through the channel of their choice, but also as well for the care team then to digitally, sort of reply back to my mum where it's necessary. But so I think, it's important where we do place the patient within their pathway, but also, in terms of where they are within this model and what can we do proactively to support them, whether they are, whether they have lower levels of activation or high levels of activation.
Yeah, and Kenny, just following up on what you said, the low level, whether you're low level activation or high level activation, everyone's still at a different point, in the continuum of their activation itself.
Yeah, 100%. And there's 4 levels of activation. And I think if I go back to my mum again, just briefly, no doubt when she was diagnosed 15 years ago, she would have been on level 1, she would have been, low level activation. But what she's managed to over that period is obviously get herself to high levels of that, that sort of patient activation.
So my next question is, how can digital communication technologies and leveraging AI and analytics positively impact patient engagement and activation? What examples do we have of technology driving this change in real life situations? And Kenny, I'm going to ask you to go first.
I think it's a real interesting question because, And I do feel quite strongly about this, is that, I think we need to start to move away, from healthcare providers, not dictating, but, deciding in terms of what is the communication channel of choice for the patient. As Natasha said before, we need to let the patient decide, what communication channel they actually want to communicate on. And we obviously need to comply with HIPAA, especially around PHI. But I think with the right consent model and governance guardrails, there is much more we can do around digital channels and digital messaging. And we should really just let the patient decide, let them choose their channel, let them choose their technology, and let's see if we can centralize it all in one place. And within this diagram here, this that we've created, as it really does encapsulate in terms of the different touch points that the patient will be having across their pathway. And no doubt, because we see it across all healthcare organizations, there will be quite a bit of fragmentation within here, and patients will be communicated differently on different channels depending where they are in their pathway. So I think, first of all, really supporting the patient to give them the channel that they can actually communicate on, but then starting, to really, bring that communication in one place, centralize it, and then orchestrate from one place, so they actually get that completely joined up patient experience, across their pathway. I don't know if Brian or Natasha, have any views on that question. If they want to come in there.
Sure, I'd love to. I as you so beautifully stated there earlier, I know the CDC did a study where they actually found an association between higher patient activation and improved health outcomes and lower costs, as Kenny mentioned. But person-enabled health actually begins with patient engagement and patient activation. Going beyond just the access. Obviously, they need access. Patients need access to health records, health data, using any patient portals or any other digital tools or technology, but making sure that they also have control or consent over who has the ability to access that data, who they share it with, but using the digital tools essentially to inform, as an education tool, provide education on how to effectively and appropriately use digital tools and technologies and the platforms of choice to build digital literacy as well as health literacy, which is quite important. And then also we hope that adoption will take place, adoption of those digital tools, whatever choice the individual decides upon, but using that in order to guide individuals on how to use the application effectively, but also for the providers in terms of gaining insights into users' interaction with the application. That's quite important as well. And ultimately, we hope that it will lead to meaningful engagement with the patient and the provider, that dynamic engagement in managing health, tracking progress towards health goals, engaging providers, and also reporting outcomes. All of this leads to patient empowerment. If you empower the patient, it leads to a partnership with the provider team. And for the second part of that question, the real life situations where technology can be used to drive change, a lot through analytics and AI. So AI technology can be used to analyze patient data, electronic health records and other relevant information that helps the clinicians make informed decisions about their patients' experiences. And as far as how AI has improved the patient experience, it provides personalized care to patients, which is what we desire and what they desire as they become more consumer-centric. Whether it's through chatbots, which I know are a type of conversational AI, or the use of virtual assistants to provide maybe around-the-clock support, medication reminders, appointment scheduling, enhancing patient engagement and satisfaction, because AI algorithms empower healthcare entrepreneurs to boost diagnostic accuracy and minimize human error, which is obviously critical when we talk about patient safety and quality of care.
Natasha, I think that's that's a really great answer, and I concur totally what you've said there. I think messaging channels, such as SMS or using the chatbot, they are totally underused at the moment. And I think, we need to, we certainly need to be a bit more brave at using those channels because, it is about personalization. I think when you start using things like NLP and LNU, to drive personalized conversations, I think that's when really we're actually going to start really engaging, patients, and nudging patients to that higher level activation. And let's be honest, everybody knows, when I say everybody, most people know how to use their mobile phone to message somebody. It's one of the most easy things to do. And, with 97% of, the US population having a smartphone, it's an open door. Yeah, we just need to start, using that technology at the right time within their pathway.
Absolutely.
And Brian, I'd love to know what you're doing, what technologies you're doing for your patient engagement and activation goals.
As Kenny and Natasha had mentioned, it's just the touch points of the patient journey have really identified where we are missing out on things. And sadly, appointment reminders, that should be a low-hanging fruit example as well. And where we are doing appointment reminders, in some cases, it's only one-way communication. So we're sending the message out, but we're not hearing what the patient's saying back, and it's making it more difficult for them to engage with us. So we are early on in our transition away from that one-way communication to using, say, Webex Connect's two-way multi-channel communications to get that recipient or that patient's response back into our EMR for follow-up, or to trigger notifications to our call centers to say, hey, we need to follow up on this call and get back to that particular patient to remove that friction. We are also looking into the chatbot option for some intelligent interactions with our patients using the natural language processing and connections back to our call centers as well. But ultimately, with that chatbot functionality, we're really hoping to also relieve the pressures off of our call centers, which are limited in staff and capabilities. So instead of we want to make those phone calls with our call centers to be more valuable, and leave the lesser valuable questions off to the chatbot, and hopefully give everybody better service overall. And ultimately, our goal is to attach analytics to all of this. That is another area that we are lacking. So we don't have the view of our patients that we really should have. And so we are working towards improving our analytics so that we know what we need to be doing to better serve them.
Right. And I think that's what Natasha was talking about, having the data from analytics to understand your patients more. And we'll have to come back to you to find out, how your journey's going.
Okay.
Post-pandemic, how are we ensuring that the investments that healthcare organizations made, are still front and center and continue to focus on the patient experience going forward? We made all these investments and we still want to make sure that we're getting something out of it. So, how are we trying to make those investments still work for us?
I can go first on that one.
Yeah, you're the provider.
All right. So one of our main investments right at the beginning of the pandemic was telehealth. For years, we knew we needed to do it. We wanted to do it. And the investment was too great, or the time commitment was too large. But then that pandemic changed everything for everyone. So we were able to get our telehealth platform up and running within a 6-month period. Fairly big investment on the technology side, a lot of effort from a lot of people to get that thing up and running, as well as getting all of our clinics and other care areas up to speed on how to use it. And now that the pandemic has subsided somewhat, we are seeing that our usage of that telehealth platform has started to drop. So we are currently evaluating the whole telehealth platform to see why it's dropping, other than people can see their providers in person again. But mostly we're looking to evaluate how we can take that investment and make sure that we're getting the most out of it. In one case, we're looking to bring telehealth solutions to the people where they may be underserved the most, or they don't have the means to get to see us in person. So we are nearby some Native American territories that do have high instances, say, of diabetes, and their level of care isn't quite what it should be on those territories, and the means to get to up to Buffalo is not that great. So we are looking to create a partnership with the healthcare facilities on the territory to bring specialized care to them via telehealth. And that's one of the channels that we're looking at to improving that care.
That's a great use case, by the way.
I think just to jump in there as well, Patty, if you don't mind, I think there's probably three areas for me. I think first of all, leadership is key. I think, if we're going to use digital, we need the leaders to really prioritize it as a strategic goal, within their patient experience plan or strategy. I think also with our co-design, I think is key, and Brian has just touched on that in terms of the use case, is looking at the patient cohort and really, looking to co-design and how we integrate digital tools, into that patient cohort and into that sort of pathway. And then finally for me, it's how you measure success. I think, it's the overall patient satisfaction and the overall experience to ensure that you keep improving. I think we all put a lot of telemedicine platforms, globally for the pandemic. And be interested to see, what was the experience like? What was the patient experience feedback like, over the pandemic, and has that changed since? So I think measuring success is key to ensure we do keep the foot down, the pedal down, in ensuring that we do drive digital adoption as much as we can.
I have to add to that. Spot on, Kenny. I have to say what's measured is managed. And a lot of times what we're hearing from providers, at least at HIMSS, is that those who made significant investments, financial investments, it was funded through the government. And so some of that money was pulled back. And with that, what they're seeing is that they previously were told, because this is something they wanted to put in place for a number of years, and they did it successfully at the initial surge of the COVID-19 pandemic. But now they're drawing back and saying, we're going to have to put that on the back burner. What I advise many of them to do is essentially use the data. The data tells the story. If you don't know, what you don't know, what you don't know. So that's one of the things that we're doing. We've asked them to take the data on patient experience, patient engagement, patient utilization, all those pieces, and build a business case to share with your leadership. But I also think just spot on, Kenny, when you talked about it has to be at that, it has to be operationalized at the leadership level. Absolutely. It has to be stakeholder buy-in at the highest level of the organization.
So we're familiar with app fatigue with providers. I think that's a big issue with our providers, but how can we address the problem of app fatigue where patients are faced with multiple patient-facing apps in hospitals, that leads to a fragmented, experience and difficulty in accessing, their own care information? Who wants to tackle that one?
I don't mind starting. I think there's app fatigue, but I think there's also, communication fatigue in terms of fragmentation. And, we certainly see it that, I touched on earlier on that patients are certainly receiving fragmentation across their pathway. And I think it does it does negatively impact their experience. And also, I think it causes poor care coordination for the patient, but also poor care coordination for the provider. And it's driving a lot of inefficiencies. We're talking about, there's a high cost of healthcare today, but what can we do to really see if we can actually, pull over all those communications in one place and really try and drive a better patient experience, but also drive some efficiencies and productivity into the provider landscape as well. So I think, consolidation is key. Consolidation of the app, the apps that they've got around the hospital is key. Consolidation communication channels is key. Bring it all into one platform and just make sure that we have a joined up experience for the patient. And I think that journey slide that we showed previously, I think again, and I think I did say before, really does show, the touch points that patients have right across their journey, and it just needs to be joined up. And whether that's outpatients or diagnostics or wherever, the challenge is how do you bring it all together in one central place and really drive, that great patient experience.
I agree with that 100%. Kaleida Health is an organization that is made up of many sub-organizations and affiliations and partnerships. Yes, I think app fatigue is out there, but also from my perspective, I think there's an appetite, that desire to have that magic app, that one single source that consolidates all of this information into one place. I agree 100%. We're working towards it, but it's a heavy lift trying to get all of these different platforms to talk to each other. So even within our own organization, but we are working towards it.
I think just jump in there as well, just on a separate note, I think, we need to start using, the FHIR standard, I believe, a lot more, and I think we need the big EHRs, to release some of that FHIR standard as well. And maybe don't put walls up, in terms of, for providers and for suppliers, and for partners. So I think, because that's what the FHIR, standard is there for, is to simplify interoperability across systems, so let's try and foster that and use that a lot more, to build these connected journeys for our patients and also for our hospital providers.
Yeah, the only thing I would add to that conversation, because I think both Brian and Kenny are spot on, is framing this because of the gaps in care that exist because of the lack of that unified communication, framing it as a risk for the patient. A lot of times things tend to be prioritized more when it's seen as a risk to the patient, to their safety, to quality of care. So perhaps framing it, the message that way, so that leadership understands how critical this particular issue is.
Yeah. And I'd actually add one more thing in addition to the patient, engagement and outcomes, is also the providers. They're the ones who are adopting it. So if they're not adopting it, they're not using it, that's an issue too. So if we can, get to that nirvana state, it's a win-win for everybody. Okay, so today, 24 million Americans lack access to high-speed internet and others face connectivity issues. So how can we work towards closing the digital divide gap in healthcare, which is a big issue in our industry? And how can technology be used to engage patients from all backgrounds to ensure equitable access to healthcare?
Access, there's physical access, lack of physical access, transportation, et cetera. And then there's that digital access. What we found is that collaboration with other industries, specifically telecommunications industry, a number of telecommunication industries, leading businesses within the telecommunication industry, were lacking in knowledge about the digital divide as it relates to healthcare. They may have been a bit more exposed in maybe education, but not so much in healthcare. And what we found is that they are really open to collaborating with health organizations to enhance and improve connectivity and offerings of high-speed internet in a number of different areas that may be a rural area or anything like that. The fiber optics and cables and all these pieces. The communication is beginning. I think that there's a lot more advancement, obviously, that needs to take place, but that has started. And it's a critical issue because digital health is the use of technology in healthcare to communicate your medical information, track, prevent, manage, and treat diseases, all of those pieces. And as I mentioned earlier, there's a growing amount of evidence that shows that the more engaged the patient is, the more likely the patient is to have better health outcomes and experiences in their healthcare journey. So in addition to improving a patient experience, digital health technologies also widen access, physical here, to healthcare for underserved communities. So for example, patients who live in those rural areas that are maybe inaccessible or far away from a physician's office, digital tools can be used to enable remote access to these patients and ensure that they're still receiving high quality care. If you go beyond location, there are so many other factors to answer the remainder of your question that can limit access to adequate healthcare. We're talking about demographics, patient's age, ethnicity, language, socioeconomic status, and gender, just a few. But all of this must be taken into account when developing technologies to ensure that all populations have equitable access to health information. You want to make sure to successfully promote equity, that health organizations must operationalize that, within their strategic plan. Also, they have to consider to be person-enabled, you have to have that flexibility and that choice and that personalization, because the less user-friendly technology is, the less likely patients are going to use it, right? So we need to it's critical that we understand that we need to prioritize patient preferences and any current pain points that they may have to ensure that the tool's efficacy and that also that they're consistent with the use of it, especially for long-term use. And we also need to simply go back to basics, meet your patients where they are on the technology continuum. So with so many different types of digital health tools that exist and that continue to be developed as well, it's important to cater to patients' preferences and be flexible in your approach to sharing relevant health information with patients and ensure the information, regardless of where it's accessed, is consistent, right? And we also need to think about language barriers as well, language proficiency, as well as literacy proficiency. So ensuring that maybe the translation of any language within your digital tools, as well as some of the localization of important health information, that it accounts for non-English speakers or those with limited English proficiency where that's the dominant language. And investing in high quality certified translations that can help improve health literacy, because that's been proven to engage a wider group of patients and also empower patients to take control of their health. And lastly, I have to say that it's important to consider all populations, including those diverse and underserved populations, people of color, LGBTQ+, those with disabilities, seniors, children, and so much more. Because there is no one-size-fits-all approach when developing or marketing a digital health tool, it's imperative to test the technology, not only for its usability, but also for its accessibility for all communities, but specifically for those underserved communities, ensuring your digital health tool is equitable for all, regardless of ethnicity, disability, location, language spoken, age, etc. Because digital health is necessary. I think we all have seen proof of this with the COVID-19 pandemic. And as the patient journey continually becomes more personalized to improve patient engagement and health outcomes, digital health platforms enable health organizations to not only personalize patient care, but also influence a broader group of patients.
Great point, Natasha. I think that was really good. I think the points that you made were really absolutely on point. And let's be honest, everybody should have option to be connected to the internet. Everybody in today's world should have the option to be connected to the internet. But I think across the US, I think there's a real opportunity. And I come back, and I said it before. 97% of US citizens have a smartphone. Adults have a smartphone. That's the captive audience. That person-centered design to make sure that is accessible for every citizen, it's vitally important. And we talked about patient activation earlier on, and the studies show, patient activation, you can be high or low. It's not about demographics. It's not about, whether you're rich or poor. It's not about whether you're accessibility. You can still have high levels of activation or low. It doesn't matter where you are. And I think we've got to bear that in mind as well, as we move through the digital health opportunity that we've got.
Earlier, you talked about, your use case of reaching out to the Native American, community there, within your so you're obviously thinking about that.
We have a couple other programs that are underway or have already been started. Most of our hospitals reside on the Buffalo Niagara Medical Campus, right in downtown Buffalo, and we are adjacent to a fairly underserved community right next door. So we have started up a program where we are providing free Wi-Fi access to that neighborhood broadcasting off of our buildings and receiving as well. And in addition to that, we're also partnering up with that Buffalo Niagara Medical Campus, the New York State Department of Transportation, and the federal government to put together a transportation program that will help facilitate providing that transportation to and from our facilities from within the neighboring areas to ensure that people that can't get here can get here and that those means are available. But as Kenny had said, you know, that cell phone is a common link. And even if we target SMS texting as a base level piece of interaction, I think we can cover a lot of our bases as far as communicating back and forth and ensuring that that care is improved, or at least less friction because of that communication.
I think it's great to hear all of these use cases and, you know, this opportunity. I think collaboration is really a big word here. You know, at this time, we have to wrap up. I want to thank Natasha, Brian, and Kenny for sharing their insights with us. It was a fantastic, you know, discussion on, you know, patient engagement and activation. We would like to thank our sponsor, Webex, once again for their support of this webinar. So don't forget to take our brief evaluation at the conclusion of today's event and share your thoughts with us. Thanks everyone for being here, and have a great rest of your day.